Hi there, my name is Philip Ideson. I want to welcome you to the Art of Procurement podcast, the podcast that helps you, a forward-thinking procurement professional, position yourself and your team to proactively take advantage of the revolution that's taking place in procurement today. By interviewing industry trailblazers and sharing insights from our own experiences, my team and I pull back the curtain and shine a light on the strategies, tactics, and tools that procurement teams are using to elevate their impact. And welcome to today's episode, where this week I'm going to share with you a recording of a recent category briefing that we held within the AOP Mastermind community. I was joined by Eric Krieg, the Managing Director of Risk International Services, a company that I've got to know really well that are experts in helping organizations manage the insurance category of spend. And in this category briefing, Eric joined the AOP Mastermind community to share more details specifically about the health insurance category. It's one of the toughest challenges for procurement to engage in the health insurance category, certainly on a strategic basis. And so we discussed the nature of the health insurance market, tips on how procurement can engage with stakeholders, and the opportunities that exist for procurement once we do get engaged. So with that being said, let's jump straight into the conversation. So I'm joined by Eric Krieg. Eric is the president of Risk International Benefits Advisors. He's a good friend of Art of Procurement. And I'm delighted that you're able to join me today, Eric. So thanks for spending some time with us and sharing the value of your insights with our community today.
Thank you, Phil. Looking forward to our discussion today.
So in our discussion, we're going to talk a few things around the health benefits and employee benefits space. I want to just start by, and actually before I do, I want to just remind folks who have joined us that you can ask questions. Please, if you have any questions at all, I'm keeping an eye on the Q&A tab here within Zoom. So feel free to pop questions in there. I'm going to open up the chat session as well. If you want to chat, send me a message directly, and we will jump on any of those questions that we get as time allows. I'm expecting this to be about a 40 to 45 minute discussion. But all right, with that being said and all the logistics out of the way, let's start at the very top, Eric. And I want to just understand a little bit more about, how do you look at the benefits category and why is it something that procurement should care about?
Well, it's really interesting. As you think about this space, it's, one of the top 3 to 5 expense items for any company. Number one. So it's a huge spend. Number two, it's highly complex. And number three, it has been contained in the world of HR.
Yeah.
And in all due respect to all the HR folks out there, their experience with procurement and really how to run processes and work to optimize arrangements is very limited.
Mm-hmm. And so, as we talked right there about HR, we want to talk a little bit today about how do we start to bridge that gap with them. Now, as you look at the benefits category in itself, like what are the components that typically make up the employee benefits? What are the elements that you kind of look at when you're looking holistically at a benefits program?
Sure. Yeah, and I think there's just a basic distinction between what we say are health and benefits and retirement plans.
Yeah.
So we'll take retirement plans. That's not our discussion today.
Right.
It's one in and of itself. But health and benefits, obviously, you said, is medical and prescription drug plans are the biggest spend. But you certainly don't want to dismiss and not pay attention to other things that add up significantly. Those are things like dental plans, vision, life insurance, disability plans. Yeah. There's wellness plans. Benefits administration goes into this category, which can get quite expensive. And let's not forget the brokers, because the brokers are a supplier, and that's how they should be viewed. They, in fact, are the sales arm for the industry.
Right. So you have all these different players. How do you see those players being incentivized? Like, what's their role in ultimately the process that goes from delivering benefits to an employee? What's the different role of all these folks in that? And how do they make their money essentially?
Well, certainly, I think depending on where we start with that, the key role with all of them is to in fact provide something of value to employees and their family members, right? So, we've got the importance of that health insurance company or some type of an administrator of a health plan. It doesn't need to be a health insurance company, but these entities who their job is to provide services to plan members. They're going to administer the plan. They may be acting as a vehicle to utilize other services that are important for that health plan. And then to be able to be in a position to, when the plan member has its claims and has its activities in the health system, is to make sure it's a smooth process. And so for that, they're making money, right? Yeah. How do they make money? That's the real question here.
Yeah.
And they're making money based upon how they've set up their contracts. And it's a really important point, as everybody on this call knows the importance of a contract, because it determines what does this thing really cost. And what happens is there's real visible fees that we see, and there's a lot of hidden fees.
Yeah.
There's hidden costs in the system, and that's a big miss across the board. And as long as those costs are properly disclosed and everybody is aware of them and it's competitive within the whole scheme of the operation, that's great. Too often, which is probably 95% of the time, they're not.
Right. I want to talk a little bit about market dynamics. You say about the disclosure of fees and whether the fees are appropriate or not. And I'll probably come back to that in a little while, but I want to talk a little bit about, how the decisions are made within an organization to determine which health benefits providers to use, whether that's medical, whether that's prescription drugs, because from a procurement perspective, ultimately, that's what we're trying to find a way of influencing. And I think sometimes struggling. I know from personal experience, I've had some experience in this space, and I always kind of got tapped out at HR. I was never really able to crack that nut of getting through HR to become a partner, because they always had brokers. So what does that decision-making process typically look like within an organization when they're selecting, for example, who their medical plan providers will be in a forthcoming year?
Well, number one, the process, the majority of time, is really run by the broker. The broker's leading the process. And so they have the most influence. And what occurs is they're really facilitating what they hear from the client. And unfortunately, because of the complexity of this space, they know what they've been told normally by their broker.
Yeah.
And so it's very self-contained, if you will. And oftentimes, there's felt to be a real limitation on options. What do I do? There's only, there's a term, and I hate these acronyms, but it's BUCA. So BUCA is the Blues, Blue Cross and Blue Shield. It's United Healthcare. It's Cigna, and it's Aetna. And that's all I have.
Yeah.
And so it's a small group. And then I've got 3 PBMs who corner 83% of the market. And that's it. And gosh, we can't do much about this. The costs are what the costs are. If I'm a self-funded plan, it's all about the claims. And, there oftentimes there's a fear of change. There's a fear of the unknown. There's the thought that I really can't do that much because I've got a limited number of entities. Are they really that much different? And gosh, I'm concerned about change.
So if you in your line of work obviously face that a lot, those that pushback, those objections, what are some of the ways that you think about helping HR overcome those kind of preconceived ideas that, this is a space that we just got to do what we're told, essentially. We don't have that much ability to drive change.
Well, so what I would first and foremost say is, for a successful engagement, we have to have the right people at the table. That means that we have to have executives who have a financial responsibility. And oftentimes that's actually the CFO.
Yeah.
Because what occurs is that, the what I would say the frontline benefits manager, director of benefits, is a very difficult place to live.
Mm-hmm.
Sometimes there is a CHRO who truly does have financial line of sight to this and has an incentive around it. But we find oftentimes it really needs to be with that executive level CFO who then is willing to take a different view of this world.
Yeah. So you need that. So that's they're then driving or influencing the HR, the chief HR officer, to think differently about something that perhaps from their perspective is, this is the way that we've always done it. So we're just going to continue to do it that way. And it's probably based on, is it fair to say that's more of a financial conversation, or is it looking at it from a risk lens, when it comes to a CFO?
Well, clearly it's both.
Mm-hmm.
I mean, because what there is, and we've seen this in retirement plans, and it's coming into the health and benefits world, there is a fiduciary risk. There is a responsibility of governance of these plan assets. That's what they are, right?
Yeah.
Major spend. And now you're seeing oftentimes it could be 50-ish% of the spend is the employee's responsibility. So that's employee money.
Yeah.
And so if this is not, properly managed and looking at excess fees and expenses in a plan, there is a liability to that. So number one, you're wasting money. But number two, you have a responsibility that you're not upholding.
Right. So if there's a procurement leader who's thinking, okay, I'm kind of getting nowhere with HR in terms of just opening this space for some consideration of how we buy it. And the best path is perhaps to go the finance route and the CFO. Do you have any tips or tricks on kind of how to do that in a way that isn't going to, for the want of a better word, put the HR team's nose out of joint so they don't want to work with you if it's pushed down then from, you're basically going around them. Have you found a way to do it in partnership with HR and going to finance, or is it typically being a discussion directly with finance and then let finance kind of and the CFO deal with, requiring HR to take a fresh look at the space?
Yeah, it's, I think it's all internal situations may have their own, uniqueness to them. Mm-hmm. Certainly, but I think being able to go directly initially to the CFO, to the appropriate, it could be COO. Sometimes we'll even see chief legal counsel get involved. So we'll see some other people who have a different perspective on things. Yeah. And so if you think about this, what everybody does in procurement and what they do in buying other things, the real question is, why don't you just apply those same dynamics to this space? Mm-hmm. And isn't it even just a bit of a procurement audit? How are you doing this right now? How is this happening? Let's work together, right? Associate with we want to better understand it so we can support you. And the basics of procurement dynamics that happen in all other parts of the business normally do not apply to benefits.
Mm-hmm. Now, do you see challenges when procurement tries to apply the same process for other areas of spend in the benefits space? And what does that do? What does that ultimately do?
Well, so challenges, number one, is your broker is your challenge. Yeah. Because they have a certain way that they want to do things, and you're going to move their cheese. Mm-hmm. But that's okay. You can do that, right, if you have the right sponsorship. If you don't, you can't get it done. So don't even try. It's a waste of time. Go ahead.
No, sorry. Go ahead, Eric. I'll ask. I have a follow-up in a second about brokers, but I don't want to cut you off midstream.
You think about this. I'll just run this dynamic by you and tell me if this sounds like what happens in normal procurement. Mm-hmm. An RFP goes out, nobody sees it. Proposals come in, nobody sees them. Mm-hmm. Nobody was a part of really choosing the suppliers who are going to be involved. What you get back is a summary of all of this and no backup documentation. And then you make a choice from that.
I think there's certainly, when you think of what I would consider more traditional, the procurement of a few years ago, well, I guess it depends on how engaged your stakeholders are. That's not unusual. And I think that's something that we fight against at Art of Procurement, is this notion of doing things in a bubble, and doing things in, and then because, that leads to a host of problems. But number one is that you're not going to get any buy-in to the end result, because, you're kind of pushing something on that wasn't, that you didn't bring the whole team, the decision-making team along along the journey for. The question about brokers that I had was, like, does there have to be a broker? Can you, as an organization, with the right people, with the right approach, with the right partners, buy health benefits, buy pharmacy benefits on your own without having to go to a broker?
Yeah, great question. So what happens is you need a broker when you're purchasing insurance, because there's a license to do that.
Okay.
But a lot of these things that we're talking about, it isn't insurance. So, you take administrative services for a medical plan.
Yeah.
You take PBM services. Those are not insurance services. Now, what happens is the reason that you would have a broker is for, it's a complex area.
Yeah.
So to do it internally without the right sophisticated knowledge of what's going on would be very difficult. And that's what the broker is supposed to bring to the table. So I want to be careful is that brokers can have an important role in the process, but it's when the employer is in charge and they're calling the shots on how the process works versus being a passive participant.
Yeah. So it's an interesting point you make there, and maybe this is interesting to me as somebody who's not in this space in a lot of regularity, is the fact that you do need a broker for the insurance, but as you say, a lot of these things you're buying aren't actually insurance. But right. I'm sure that there's a lot of people that have incentives to make you believe that it is insurance, so that they retain those broker relationships. I know when I was involved in buying it, I found my stakeholders would stand behind, well, we need this broker and we've used this broker for 20 years. Like, we don't have any other choice in that. I just see a question that came in from Helen, asking if that means, like, from a broker and the end service that we're buying, whether that's insurance or not. So you have two different contracts. Is that fair? You have a contract for your broker, and then you contract separately with your pharmacy benefits provider, or your health insurance provider, or your life insurance provider.
Yeah, so let's talk about that. That's a really good question. Everybody should have an agreement with their broker if they have a broker. And that agreement should be very clear about what their scope of services are, the basic provisions of how they are earning compensation. We believe it is a best practice to clearly have a flat fee arrangement. Okay. Because there is so much hidden compensation in this world. The conflicts of interest are significant. And so what happens is you want to make sure that the broker is obviously paid correctly, but it's all very visible. We had an account recently that we worked with, that when we went through our diagnostic process, we found that the broker had built in 19 streams of revenue on this account. And the client had no idea. And so this creates all sorts of conflicts, and it takes the system, and this is extreme, but many hidden sources of revenue isn't. But what occurs is this then influences behaviors, who's involved, it influences the analysis that's done, and ultimately what you get.
So what are some of those, like, just examples of some of the hidden fee, streams or revenue streams that you see in some of these agreements, whether that's from a broker or whether that's actually more directly with a benefits provider?
Sure. Can we have a session on that all in of itself?
All right. I'm looking forward to that one.
What you have with it, I mean, so we have commission. So number one, just clarity. I'm sure most of us know this, but a commission is, while it's paid by the insurance company, it's just built into the premium. So you're paying for it, whatever it is. You have what are called PEPMs, per employee per month fees. You have then all forms of supplemental compensation in the way of, you can have compensation based upon that broker's business with the insurance company. You can have placement bonuses. You can have within here's one, this is still football season. I think we're kind of done with college, but our friends at Aflac, as an example, who have done a phenomenal job of selling insurance products to employees that are 100% employee paid. Right. So what occurs is that the employer becomes a sponsor, if you will, and they facilitate the sale of insurance to their employees. Well, let me be very, very clear on this. The value of those insurance products is extremely low. What it means, what they pay in premium versus what's ever paid out in claims is like the lottery. Yeah. And built into those products are a whole bunch of commission. So the more of those products that they can have in place, the better off they are. Right. There's revenue built into prescription drugs. How about if how's this? For every prescription that somebody gets, you get a little bit of money on that, a spiff on it. So outside,
and that's a broker that's getting that.
That's a broker who's getting that. Yes. So there's it's embedded, if you will, in arrangements. And what you also have then is within the insurance company arrangements. So, if you think about insurance, I mean, for a health insurance plan, basically, when you get over 250 people need to be really seriously considering self-insurance to try to take excess costs out of the system. So when you do that, it seems pretty straightforward. You should contract for services and somebody's going to pay a fee for that, but you have hidden fees that maybe they end up looking like a claim. Yeah. Or there's some type of a shared service arrangement for, basically for them to be doing their job the way they should. They're going to get extra money in doing that job. And it never shows up as a fee. It really shows up as a claim. So those things oftentimes are missed. I would say, once again, well above 90% of the time, it is just not known.
It's kind of hidden as seen as a claim, while people just look at it as, you mentioned self-insurance there. I'd love for you to share a little bit more about your thinking around when is the right time to self-insure versus when that might not be appropriate.
Sure. Yeah, I mean, certainly smaller groups, if you're under 100 people, it would be rare that you should self-insure. And so you're just going up. And we think about the break point that you really need to seriously look at. It's around 250 people. So you have an appropriate size, because we talk about self-insurance, but you're still buying insurance. It's a stop-loss insurance, because until you become a jumbo employer, you need insurance, because the high-end risk is just too much. Yeah. And what's interesting in the process is that people have their broker do this analysis for them. Well, the margin is all on fully insured business, right? Both for the insurance company, it's risk margin. Risk margin is good. Also, the brokers make more money on fully insured business. And so what we see we go in and look at the analysis work that was done. It becomes, it's like I'm talking to my 5-year-old, and all due respect to everybody. So the brokers put this out. It looks, well, okay, that's right. That's got to be, and the numbers are the numbers, and no, it doesn't make sense. They just don't know. They don't know the questions to ask. Yeah. They don't understand how the numbers would have come together the way they are. And all of a sudden, it just didn't look like a good deal. And so we've heard this so many times for these employers in that, say, 250 to 500 range, they're still fully insured. And we ask, what's happened in their review of those, of their insured arrangement. And they said, we look at it every year. It just didn't make sense. Mm-hmm. Well, the reality, it didn't make sense because the analysis was poorly done.
Right. And it sounds like there's a lot of incentives to stay fully insured just built into the buying process that,
Yes.
we've talked about for the last few minutes.
Mm-hmm.
So, obviously in your line of work, you work with organizations to help them get more control of their health benefit spend, and all benefit spend and insurance spend, but specifically thinking about health benefits. How do you go about doing things differently? Like, what changes do you make to the buying process which enable you to help your clients get better results? Because there may be some of the things that you're doing that folks who are listening and actually are watching today can take as to-dos for the way that they're thinking about how they manage their health benefits.
It all, everything we do is based on facts and information, which is the wonderful thing about it. It's getting the information. So here's an interesting thing. So as we do that, we're gathering all sorts of information around the way the plans are structured, the cost elements within the plans, all of the suppliers.
Yeah.
So what do you think the ability it is of an employer to manage this expense if they don't have that information?
Right. It's impossible.
Yeah, and they don't. They have it eclectically. It's not well, they don't have an inventory of these things. So we go to the broker 90% of the time to get it. Mm-hmm. The number of times we even see contracts that haven't been executed, they can't find a contract. They give us something they think is a contract. It's not really a contract. We're looking for everything associated with the cost of the plan, from fees, expenses, premiums, claims, and it isn't there. And so that's the number one thing, is that that employers overall do a poor job of the management of their data. It is their data. So that's one. But then everything becomes all of that information tells a story of where we're at. Well, how have things been managed? Where are costs at? What can we do with it? And what must we pursue? And there's a real thought process around benefits that creates this stop moment. Oh my gosh, you're going to change. The employees are going to all leave. We're in this we're in this great resignation, especially right now. We can't touch this stuff. It's stay away. And if you just apply the appropriate governance protocols, it's not about changing employees' plans. It's actually about being able to have more money if you want to invest back into your employees in some way, shape, or form, or whatever one wants to do with that within their business. But nobody gets a bonus because they paid too much for the plans that they're offering to their employees.
So go ahead.
I think here's a really good example. I'll give you an example. It just happened this week.
Yeah.
A really simple thing. So we're engaged with a client, and the client, it was a late engagement for 1/1/22. Not much we could do, but that we had done a bit of an analysis to see what could happen. And we noticed this is a employer of about 2,000 people. They're self-funded. They have stop loss insurance. Mm-hmm. The broker did not do any competitive exercise in stop loss. Stop loss insurance is a behind the scenes insurance transaction.
Yeah.
They accepted a 15% increase. That sounded not terrible. Oh gosh, it could be a lot worse. Right? So we challenged that. We had the time to then work with the broker to make sure that a proper process was run, like everybody here would do.
Right.
The end result was $600,000 better on one piece of the equation.
Right.
It has nothing to do with changing employees' benefits or anything. It's the insurance protection of the plan.
Yeah.
They were just going to pay that much more.
So it's interesting because actually my question was around, as you are working with organizations and you're getting more, essentially helping them get stronger plans, whether that's additional benefits, whether that's lower cost, do you find that most times you're not actually changing the employer's plan? The employees are not seeing a negative difference because you're telling them that their plan that they wanted or their insurer that they're in network for is not available next year or anything. It's more things that are happening behind the scenes where you see the value, as opposed to we got to move everybody off Blue Cross and move them to, Aetna or something like that.
Yeah, it's a good question. So, first and foremost, you want to make sure, are the incumbent arrangements appropriate?
Mm-hmm.
By the way, on the story I told, which is relative to this, the incumbent matched that price.
Right.
We didn't change a thing. We didn't even, and so, but what we all know is if we hadn't run the process, the incumbent does nothing.
Right.
So first and foremost, if you have the right lineup of suppliers, optimize them. That's all, right? And to make sure that the only way you can do that with the facets of information of how things are structured with them. What does that contract look like? By the way, what services did you buy? Did you buy a bunch of low value services? That happens all the time as well. Right. Nobody's even using them, but you're paying for them. The lack of oversight of contract management around, did you do any audits? Should you have done an audit? When was the last time you did? What kind of an audit? What could you get out of that? What did you have? You put this contract in place, you had a performance guarantee. Oh, you never pursued your performance guarantee. So you're really looking at things that you can do within those current arrangements. But once again, as you know, so here's what happens. Unless you set up the right dynamics, they don't take you seriously.
Right.
So the broker won't take you seriously.
Yeah.
Because they're gonna have behind the scenes messaging about, we just got to go through this process. Don't worry, I'll protect you on it. Type of thing.
That brings up an interesting question. Like, where's the fiduciary duty of the broker? Do they have any?
They have none. And that's what the real missing point is. Here's what occurs is that the lack of a fiduciary structure on health and benefits as compared to retirement plans is poor. Mm-hmm. Fiduciaries are not identified. People don't even know who they are. They make assumptions about it. They're not terribly concerned about it. They're not running a governance process to make sure that there's appropriate annual disclosures that are taking place, that there's appropriate protocols around contract management. Once again, a whole thing in and of itself, because the vast majority of all contracts, the supplier is chosen before anybody even sees a contract. And so the ability to do anything with that contract after the fact is, as we all know, is very difficult.
Yeah.
And that's where all the juice is. It's sitting in that information. And people just don't think they really have any influence over it. So I don't understand it. So I won't, what do I do? I mean, they'll have their legal team look at it to make sure that basic legalese is correct in the contract.
It's like personal health benefits here in the States where you need to take a trip to ER, but you have no idea what it's going to cost until you get the bill after you've been there and you've got no influence or leverage whatsoever to negotiate it at that point.
Right.
But on a corporate scale, and I speak, from personal experience of like a month ago, I was going through that experience where you just get hit with these bills and you have no way of deciding beforehand. Should I go to this hospital? Should I go to that hospital? A procurement person's nightmare in not being able to do a cost comparison.
And one of the things I will say, Phil, going back to your question though, sometimes it is the wrong suppliers in place, as you know. Yeah. It's just not the right suppliers for the dynamics of this particular employer and their employees. Mm-hmm. So sometimes that needs to change. Sometimes there you can supplement the current suppliers with something else that might be beneficial.
Yeah.
So there's a lot of moving parts. I mean, what happens is the players in this, I mentioned this small group, because of all the money in the system, the number of players coming in trying to provide services can be overwhelming. And you've got to be able to sort through, fact from fiction, who really has a value proposition that works, how might that work within a plan. But ultimately, the need to change benefits in the way of degrade benefits or make people pay more to save money. The employers have been doing that for the last 20 years. They've shifted so much cost. One of the risks that is not reviewed in any way, shape, or form the way it needs to be is the financial risk that employers have put onto their employees because of their out-of-pocket exposure. Right. And the fact is, based upon their income, if they had to come up with $5,000, $10,000, $15,000, it might as well be $1 million because they don't have it. Yeah. It's not there. So there has been a lack of appropriate oversight for employees' financial exposure and what you can do about it. At the same time, by not doing the right governance on the program, money's going out the back door.
Right. It's kind of shifting the risk to the employees.
That's right.
I have just a couple of other lines of questions for us today. And of course, I do see another question that came in. I want to address that in a second. But if anybody else does have any questions, please let me know. And what I wanted to talk about brokers is governance from a procurement perspective. What can we as procurement do to actually hold the brokers account to be doing their job so that they feel or that there's a duty that they have to us as an enterprise as opposed to the benefit providers. Helen asked a question which might be related to this, is around contract KPIs having in place, and other specific KPIs we should have in place with our brokers to help keep them accountable.
Well, yeah, certainly. So there's a few things here. Number one is an open and transparent process. Mm-hmm. That's it. And it's required. It's not an ask, it's just required. And the requirement is that an RFP does not go out to the market until it has been signed off on by the company.
Yeah. There
is an agreement on all aspects of the proposals, and that you're going to have, those proposals are actually yours.
Yeah. So you're making the decision, not the broker in a vacuum and just telling you this is the best that they could find.
Yeah, and so what are key things with the RFP? There's all sorts of stuff, but here's a basic one. Well, what is the broker asking for in the way of compensation? Mm-hmm. It should be spelled out, and as I said, the best practice is it's zero.
Yeah,
and it's a flat fee from the employer.
Yeah,
and you're trying to mitigate then their conflicts, but then you're also looking at, are they going to a few suppliers that pay them money? Mm-hmm. So here, there's these panels, preferred suppliers. Well, they got on that panel by cutting them checks.
Yeah.
And so they're paying to be on that, plus they get all this additional compensation that's not disclosed anywhere. Mm-hmm. So it's having true sight of what's going on and making sure this is going to work out for you, and then understanding, as this is an open process, asking the basic questions that you ask across all forms of supplier procurement and management. And when this high-level summary is done, it can be done in such a way, it's just directing, it's been done to direct you to this place. And maybe it isn't where you should be going.
Right. And do you find that, because I think back to my experience again, but I know that my experience is limited and it may not reflect the reality of other organizations. But when I would look at a broker, the dollar spend that would be shown, within my spend analysis on how much I'm spending on that broker was relatively low. So, in the typical procurement mindset is, okay, so I'm spending 70 grand or 120 grand or whatever that number is on this broker this year. And yes, decent sized number, but I've got bigger fish to fry, so I'm not going to worry about it. But the reality is that that's kind of just the entry stakes, the table stakes for them, because they're getting these fees on the back end that we don't see. So do you see a lot of organizations not really challenging that broker relationship because they just look at that as being a relatively small spend without taking into account the bigger picture of what's going on with that relationship?
You hit it, Phil. Absolutely. That it is a big picture thing. It is big picture both on what they receive in other forms of compensation that are not disclosed, but it's also how it influences the suppliers you're choosing, and what that is really costing you. And what we see across the board is that the spend in this area for that work is easily, I think, when we're involved, generally speaking, we're reducing that by over 50%.
Right.
And it's not, and to your point, if somebody's spending $50 million, $5 million on their spend, and then they're just comparing it, well, number one, they're really just not paying attention with it, because the people who are managing the broker have a relationship with them. Yeah. They're uncomfortable even having the discussion around it, and they don't even address it because of the discomfort, and they have a good relationship. They went to the ball game, they went to dinner, they went to the play. And that stuff happens all the time, and it influences the relationship and the willingness to have good business discussions.
So I know we're kind of coming against time, and I have one other kind of question that I'm just interested in your perspective on, and this is more kind of a broader market conditions question. I'm not even sure if the question is relevant to 2022, because everyone's got their deals in place for 2022. Even thinking about the outlook for 2023, like, where do you see health insurance costs going over the next 12 months? Is it continuing to increase? Are there some landmines that people should be looking out for as they look at their expenses? Like, what's just kind of the word on the street in terms of the way that the costs are going in this space?
Yeah, so what the word is on, when you listen to the industry is going to tell you that the costs are going up. The trend is 7 to 8%. And then, based on whether somebody's fully insured or self-funded, how that dynamic works for them. And what occurs, what the real fault here is that if somebody does better than what they think they should do, they think they've done a good job. Yeah. Or if their cost is under a quote benchmark, they've done a good job. It still doesn't mean there is not material excess fees and expenses. I would assure everybody here that the majority of employers have at least 10% extra costs that they're spending. That has nothing to do with what people are talking about, future costs rising, are my costs competitive? Aren't they competitive? Whatever it is, it's just there is waste in the system and needs to come out.
Well, Eric, I want to thank you so much for your time today. It sounds like there's a lot of opportunity for procurement to kind of crack the nut in the health insurance space, but it does require some exec buy-in to help you along the way if you're getting a lot of resistance. But there's a lot of stones to be unturned that we probably haven't been turning over where opportunity can be found. So I really appreciate you again sharing the benefits of your insights with us. And the final question, which I always kind of say is the easy question, is if anyone who is watching today or listening to this at a later date will be interested in learning a little bit more about what you do or connecting with you personally, where is the best place for them to find you?
Well, the best place is, we're at Risk International, and I'm at ekrieg@riskinternational.com. Okay. And would love to entertain any questions that anybody has to dive deeper in this topic for what you may be dealing with.
Perfect. All right. Well, I'm going to call a close there today. I want to thank everybody in our audience today for joining us, for the questions that you submitted, and enjoy the rest of your day. If this episode struck a chord with you, please do send it to somebody. We grow here at Art of Procurement through word of mouth, and that would be really appreciated. You can also support us by giving us a thumbs up, a star rating, or a review wherever you listen to your podcasts. Since 2015, we've built the world's largest free resource for procurement professionals looking to elevate their impact. Our resources span podcasts like this, videos, blog posts, papers, and events. To join us on the inside and to ensure you never miss an episode, a webinar, event, or a post, please do subscribe to our weekly newsletter, This Week in Procurement. You can do that at artofprocurement.com/subscribe. That's artofprocurement.com/subscribe. Thank you for joining us today, and I look forward to seeing you again soon.